Hi there, and welcome to your nervous system assessment. My name is Calliope, and I'm going to be performing all the little tests from your head and face to your arms, your legs, hands and feet. We've got quite a few things to cover today. So I want to go over with you this diagram that I have. We'll get a little more up close and personal in a second, but we have a lot going on with the nervous system. We'll talk a little bit about what kind of nerves we have, where they're at. We have this colorful chart of all these different nerve areas. So we won't cover everything in one fell swoop. We'll just break it down into little bite-sized pieces. Let's go ahead and just start by talking about the types of nerves, as well as the difference between the cranial and the spinal nerves, the central nervous system, peripheral nervous system. Let's start with that. Okay. So we have quite a few things going on here on our chart. We have a little diagram of a little dude. We have our head here, the arms, the legs, the foot. So we're going to zoom in to this guy right here, and we're going to talk about that a little bit. So we have three types of nerves. We have afferent nerves, which travel from the nerve and transmit information to the central nervous system, to the brain. This would be, for example, the nerves in your eyes, which transmit visual information to the brain. We also have efferent nerves, which take commands from the brain and send them out to the nerves. We see this in muscles, for example. These are our motor nerves. And then you have mixed nerves, which can do both. They can receive sensory information, take it to the brain, or they can also receive motor information from the brain. So we also have spinal nerves and we have cranial nerves. So our cranial nerves are going to be focused primarily in our head for the most part. We do have, for example, the vagus nerve that travels a lot longer. We have the accessory nerve as well that is outside of the head, but the cranial nerves innervate the head primarily, and they originate from the brainstem area. And then our spinal nerves originate from the spinal cord and run through the rest of the body. So our central nervous system is going to be primarily our brain and our spinal cord here. Our peripheral nervous system is going to be all these other nerves running throughout the body. And we'll go through quite a few different areas, but we're just going to start. We're going to start here at the head. So we're going to talk in a second about the specific nerves, but we're going to start with the head and the face. So right in here, primarily what we're dealing with are cranial nerves. There are just a few of these that are relevant here. So we're going to have a mix of different tests to do for those. So let's take a look at our main sensory nerves. So this is a bit of a limited diagram in that primarily what we've got here is cranial nerve number this is our trigeminal nerve. The trigeminal nerve has 3 main branches. That's why it's called the trigeminal nerve with that 3 prefix. We have the ophthalmic region right in here, or V1. We have the maxillary region right in here, V2. We have the mandibular branch right in here. And then we have the superficial cervical plexus right here and the cervical nerves right in here. But we're going to be focused primarily in this area. So this is our sensory branches, but we're also looking for the motor function in the trigeminal nerve. So the trigeminal nerve, those are muscles of mastication. We have the masseter underneath the pterygoids, and we have the temporalis right in here. So we'll test those. We'll test some other nerves that have motor capabilities as well. So we are going to start with cranial nerves number 3, 4, and 6. The oculomotor, the trochlear, and abducens nerves, and these govern eye movement. So I'm going to have you look at the end of this little stick here. We've got a rubber ball, and I am going to have you just follow this using only your eyes, so we can isolate those nerves there. And just follow this wherever it goes. Wherever it goes. It might be a little random, irregular, but we just want to make sure that everything is working correctly. So we've got the trigeminal nerve, which we've talked about. We have our facial nerve. We'll hit the hypoglossal nerve. Quite a few different nerves, but certainly not all 12. Just keep following this. We're going to go in and out. Let's bring that way out and bring that back in. Good. And just keep following that. Keep following the little ball here as best as you can, even if it goes out of your vision. Back in. Out. Good. So the cranial nerves are a little easier, if you will. And as you saw from our chart, we've got a whole lot going on with our brachial nerves, with our lower extremity nerves. But we'll get everybody. We will get everybody. Okay, you can go ahead and rest your eyes there. I'm quite satisfied with that. So, we are going to test both the sensory and motor function of the trigeminal nerve. And to do this for the face, we are going to tackle quite a few different modes of sensation. So depending on the type of nerve, depending on what it can sense, we have a few different styles, I suppose, of sensation. For example, today we are going to test pressure, the ability to sense pressure. We are going to do the ability to sense soft sensation. We have sharp or pinpoint sensation. We have cold and vibration sense as well. So that's how we're going to test our sensory nerves, get a wide swath of types of sensation. And then motor, we are going to be focusing on the muscles of mastication for the trigeminal nerve. That's the motor function that it governs. So let me grab my little tools here. And do you mind if I start by pressing on your face? Okay, just let me know when you feel that pressure. Go ahead and close your eyes. No peeking. Okay. All right. Good. 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 So we're getting our three main branches that we had looked at: ophthalmic, maxillary, and mandibular. Okay, now I'm just going to do this a little bit around your head as well. So how about here? Good. How about back here? Good. Here. Okay. Right under over here. 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 Good. Right there. Okay, excellent. So let's bring out our cotton bud here. So this is going to feel soft. I'm just going to test this on your jaws so you know what that feels like. Just like that. Keep your eyes closed and just let me know when you feel that soft touch. Good. Okay. Yes. Good. Yes. Good. Excellent. Now, our little pinprick sensation, pinpoint, is going to be a toothpick, and as you can see, I'm going a little hard at it, but it does not pierce the skin. I mean, I really went hard at it, so it does do a little bit of that indentation, but I'm not going to go nearly that hard with you. So, eyes closed. This is the sensation we're looking for. Just tell me when you feel that. Okay. Good. Yes. Mm-hmm. Good. Yes. Good. Okay. Mm-hmm. Excellent. Now, vibration and cold. We can kind of do these concurrently because I can strike the tuning fork here. And the very first sensation we'll get is vibration. And then we'll do cold. Alright. So, eyes closed. Vibration. Good. Cold. Good. Just like that. Cold. Good. Cold. Vibration. Cold. Vibration. Cold. Cold. Good. Cold. Cold. Vibration. Cold. Very good. Okay, so that was the sensory aspect of our trigeminal nerve. Now I am going to have you clench and unclench the jaw. I'm going to palpate the masseter muscle as well as the temporalis. We cannot get into the pterygoids, our medial and lateral pterygoid. Those are our other muscles of mastication. Those aren't deep, however. The masseter and temporalis are the superficial ones we can actually get to. If I could just have you clench the jaw, unclench, clench, unclench, clench, clench, unclench, clench, unclench, clench. Excellent. For cranial nerve number 7, this is a motor nerve that governs facial expression. So, if I could just have you follow some instructions for me. I'm going to have you smile real big, showing your teeth. Good. And can you puff out your cheeks? Good. Can you close your eyes real tight? Good. Open them real wide. Good. Can you raise your eyebrows? Can you raise one eyebrow? Can you raise the other? I cannot. Okay, so that all looks excellent. It is symmetrical on both sides. It doesn't look like there's any palsy at all, for example. Looks great. Now, our hypoglossal nerve is a very easy one. This governs tongue movement. So if I could have you stick out your tongue, and if you could move it this way, good, this way, and up, and down. Can you put the tip of your tongue to the roof of your mouth? There we go. Excellent. Now, I want to do a little bit of head range of movement. So our nerves in the C1 to C6 area, as well as C1 to T1, are going to be our neck, flexor, and extensor nerves. So I'm just going to have you follow along with some head movements so we can test those. So I am going to have you move the head backwards and forwards, backwards and forwards. Good. Tilt to one side, the other, or rotate rather. One side, the other. Perfect. Tilt to one side, the other, back to this side, and the other. There we go. Okay, so our accessory nerve is next, and technically this is one of the cranial nerves, although it's kind of a bit of a strange nerve. It's also called the spinal accessory nerve as well. So I am going to have you shrug your shoulders, just like this. And we can see if there's any weakness in the nerve by seeing if you can shrug your shoulders. If they're bilateral, if they have full range of movement. Okay. Very good. Excellent. So let's go ahead and move on to the phrenic nerve. Now, this one is around the area of C3 to C5, mainly C4. But this innervates the diaphragm. So this is going to be a very important nerve for your ability to breathe. So I'm going to guide you to breathe. We're just going to assess your ability to breathe. So if I could have you take a deep breath in and out. Just like that. Deep breath in and out. Deep breath in and out. There we are. The diaphragm is obviously extremely important for our breathing, and our diaphragm's job is to pull the air in, literally pull it in, almost like the plunger on a syringe, pulling the air in and then physically pushing it out of our body as well. So why don't we go ahead and just jump back to the diagram so we can look at the arm. So we have the anterior arm and the posterior arm. We'll see a little bit of the brachial plexus, more like the area of it, and all the little nerves innervating the arm. So this is kind of a lot right here, but we're going to focus right in this area. So here we have the anterior arm, which is this inside of the arm. This is the posterior, the back of the arm. And these are all of our little nerve groups here. So, for example, we have the axillary nerve right here on the anterior, here on the posterior arm. we have the lateral antebrachial cutaneous nerve, part of the musculocutaneous nerve. That's this green color right in here. We have the palmar cutaneal branch, which is right in this area. This is part of the median nerve. We have the digital cutaneous branch, which does a couple fingers here, and the thumb we have a little bit right in here as well, this little sliver of the finger. The superficial branch is going to be part of the radial nerve as well. On the back of the hand, we've got a little bit of a cutoff of the fingers, and then it's in this area. We have the posterior cutaneous branch of the forearm, right in here with the radial nerve. We have the posterior cutaneous branch of the arm, right here, this purple. That's part of the radial nerve. The lower lateral cutaneous nerve of the arm. It's kind of hard to tell here. This is pink, this is red. This is also part of the radial nerve. The superficial branch of the ulnar nerve, which is going to be these little fingers right in here. We have the palmar branch of the ulnar nerve right in here. The dorsal branch of the ulnar nerve. We have the intercostobrachial right on the inside of the anterior arm and along the posterior arm here. Medial cutaneous, this little strip here, right in here. And then we have medial antebrachial cutaneous running this big swath right in here. So we're going to test all these little areas and see what's going on with the nerve function in the arm. So we have a few different areas to get to on the arms. We're going to test our 5 modes of sensation as well as quite a few motor tests as well. Now I'm going to start with pressure, and instead of doing sharp with the toothpick, we're going to use this bad boy. This is called a Wartenberg pinwheel. This is a neurological tool for this specific purpose. But everything else will be the same, including our cotton bud. Now, let's start up here at the axillary nerve, and we're going to start with pressure. Let me know that you feel the pressure here. You do. And on this side. Good. And we're just going to keep going. We'll get our little areas and make sure everything is responding correctly. So we have that. Let's get the inner arm here. We'll do our little intercostobrachial nerve. Good. And about right in here. Medial cutaneous. Good. And along the forearm here, if I press in here, here. Okay, here. That comes in loud and clear. We have the lateral edge of the anterior arm here, and here. Good. Other side here, and here. Yes, very good. Now the hands, quite a few areas here. So we will get our median nerves. So we have our few fingers here. You feel that? Okay, and on the palmar branch. Good. Ulnar on the other side, right here. Yep. Good. And below that, we have our radial area. Okay, let's go ahead and flip the hand over. Right in here. Okay, good. Radial. Median. Radial. Right in there. Excellent. Excellent. And then we have ulnar right here. Okay. Now, other side. We'll start with the anterior hand and radial, medial, ulnar. Good. And flip that over. We will do ulnar here, right at the back here. Good. Ulnar. And here are the tips of the fingers, the median rather. Okay, radial. Good. Now, soft sensation. So, start at the axillary. Feel that? How about here? Yes. Let's get the inside of the arm here. Good. Right there, medial cutaneous. Good. Inner forearm here. Good. Outer forearm. Okay. The other side. Intercostobrachial, medial cutaneous, good, inner forearm, outer forearm, okay, and now to the hands, palm side first, alright, on the fingers, good, these fingers, on the palm, the lateral edge, and the medial. Okay, flip it over. Fingertips. Good. Lateral edge. Medial area. Very good. Other hand. Fingers. Good. Last couple of fingers here. Yep. And the palm on the outside. Palm on the inside. Flip her over. Fingertips. Good. Lateral edge. Okay. Just let me know when you feel a sharp sensation. Good. We're just going to run through one arm and then the other. Good. Good. And the hand here on the thumb, first and second finger. Okay. Third and fourth. Outer palm. Flip the hand over. Inner arm, I know this is a weird one here. Good. Okay. Lateral forearm. Hand. Fingertips. Good. Outer palm. Flip the hand over. Outside. Inside. Fingertips. Very good. Okay. Last one, vibration and cold. Vibration. 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 Cold. 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 Good. Vibration. Vibration. Hand. Vibration. Okay. Cold. 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 Good. Vibration. Vibration. Cold. 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 Okay. Back of the hand. Vibration, vibration, cold. Okay, other arm. Vibration, good. Cold, cold, cold. Good. Cold, cold, cold. Okay. Cold, cold, cold. Good. Other side of the hand. Vibration. Cold, cold, cold. Okay. Now, for our motor function here, we have quite a few different movements that we need to test. First, I'm going to have you rotate the shoulders, just roll them back and forward. Good. I'm going to have you raise your arms in front of you and go ahead and bring them backwards. Okay. Come up from the sides, touch the backs of your hands together. Excellent. We are going to have you flex and extend at the elbow here. Right here. Good. I'm going to have you supinate, pronate the arms here. So rotate them like this. Very good. We are going to have you flex and extend the wrists here. Extend, flex, flex and extend. Okay, can you rotate the wrists in? Rotate them internally, externally. Very good. And then the fingers. Can you extend them and flex them? Extend, flex. Good. Can you splay them and bring them in? Good. Adduct and abduct. Very good. Now let's go ahead and just jump back to our diagram. We are going to look at the leg, we're going to look at the foot, and then we're going to do our last part of the assessment. So like before, we have an anterior leg, a posterior leg, and then a freehand drawing of what I remember what a foot looks like. And this is our little section. So there are some nerves here in the leg that also correspond to the foot. These couple are foot-only nerves. So what do we have here? We have the nerve roots of the S1 and S3 nerves right in here. We have the nerves of L1 to L3 right here. This is the posterior leg. So this would be in your gluteal muscle region. We have the iliohypogastric nerve on the outside of the hip here. The subcostal nerve right in here. We have the lateral cutaneous nerve of the thigh on the outside of the leg. We have the posterior cutaneous nerve of the thigh in salmon here. The femoral nerve in purple. The obturator nerve right here. We have the genitofemoral in green, and the ilioinguinal nerve right in red here. And then we have the saphenous nerve in sky blue here, and also on the foot, right on the inside of the arch. We have the sural nerve in this blue-green color, which is also on the foot here. Superficial fibular nerve right on the foot, and it should be right in here as well. And you have that little bit of green there. The deep fibular nerve right at the top of the foot in red. We have the medial calcaneal nerve, part of the tibial nerve, the back of the foot here and right here. Then we have the lateral plantar nerve, part of the tibial nerve here, and the medial plantar nerve, part of the tibial nerve, right in here. So we have quite a few areas here, but we are going to leave off a couple of these. So we are not going to get to our obturator nerve and our iliolingual nerve. Those are just real in the inner thigh that we don't really need to do. But we can get this little area right here, the outside of the upper thigh, everything else, if that's okay with you. Okay, excellent. The bugs are really going at it tonight, aren't they? Yes, that's summer for you. So I'm going to start with pressure. We are going to do the upper thigh here. So we have our lateral cutaneous. Good. We have our genitofemoral nerve. Good. And then we have the femoral nerve here, big area. Okay, we'll get into these smaller areas here. So lower leg, saphenous, sural, superficial, fibular. Okay, we have that little spot right here for the deep fibular. And then we have the medial calcaneal nerve, part of the tibial nerve Okay, and we'll do your feet all in one fell swoop. Leave that for the end. So, soft touch here. Let me know if you feel this. So we'll start right in here. Good. Okay. Nope, right along that midline. Good. And how about here for the femoral? Here. Good. And saphenous. Yep. Sorrel. Good. And how about the superficial fibular? Deep fibular. And calcaneal here. Good. Sharp. Let me know when you feel this. Yep. Mm-hmm. Good. Yes. Mm-hmm. Good. Yep. Good. Other side. Yes. Mm-hmm. Good. Yeah. Yep. Yes. Mm-hmm. Yeah, that calcaneal one. That one's really sensitive to the little pinprick sensation. Cold and vibration. 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 Cold. 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 Good. Vibration. 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 Good. Cold. 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 Okay. Vibration. 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 Okay. Vibration. Vibration. Cold. 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 Good. Vibration. 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 Good. Cold. 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 Now, lastly, we'll do our little bit of motor function testing. So, I'm going to have you start with the hips. If you could, one at a time, move a hip out, bring it up, bring it back down, out, in, up, down, out, in, up, down. Good. So we've got that hip movement. I am going to have you extend your leg at the knee, so kick out your legs, bring them back in. Very good. And can you make your feet go up and down? And in and out. Roll the ankle in. Roll the ankle out. Very good. And just the toes. Up and down. Up and down. Very good. Can you splay the toes? That you can. Excellent. So that is going to conclude our nervous system assessment today. So everything had the correct sensory response to all our types of sensation. We had the correct motor function as well. I have absolutely no qualms about any of your nerves. Do you have any questions for me at all? Okay, excellent. Let me sign off on your chart here. I'd like to thank you so much for allowing me to assess your nervous system. I hope you have a whale of a day. Good rest of your night. Thank you. Thank you so much for watching. I really appreciate it. And a big thank you to my patrons on Patreon, without which I wouldn't be able to make these videos. If you'd like to help support the channel, I have a link to my Patreon in the description box below. I offer perks like early access to videos, ad-free videos, Patreon exclusive videos. We have audio downloads of all my videos as well. Quite a lot going on over there. I hope that you have a whale of a day and a good rest of your night.